Namaste, this is Dr. Vinod here and I hope you're doing well. This is the second video of the series on low back pain, a common problem that many of us suffer from. In the first video I had discussed about the causes for mechanical low back pain and also the pathology behind it, the link of which you can find above right now scrolling on the screen. Remember that during the exercises, if at all you feel a sharp pain, then avoid that particular exercise and give it a pass and move on to the next one. Do not stop doing all the exercises completely because of that. Also, if you have a persistent pain which is present all the time when you're doing the exercise, then it could be a warning of something more severe, and hence you have to stop doing the exercises and seek from medical consultation for your problem. So these exercises are meant for mechanical back pain. So let's get started. Nowadays we do spend a lot of time sitting during our waking hours, and this may be sitting at the office desk, sitting at home on the sofa or the dining chair, just sitting and watching or reading. And this puts a lot of strain on the lower back. Now there are a couple of factors which are key, which we tend to ignore. One of them is the first one is basically the design of the furniture or the chair that we sit, and the second one is the posture. These are the two things that we usually do not pay much attention to. So let's start off with the first one, the design of the furniture. Now this is a very good chair which I've got at my workplace, and it's got all the features that one would look for in a well-designed supportive chair. So first thing is it's got a very good lumbar support. If you notice, there's a curvature here at the back of this chair, and this supports the lower back. The second thing is it's got a very good armrest, and that helps to rest your arm to offload your spine when you're sitting, and it's got a very good and deep under thigh support. Now these are the three essential things that we need to have in a good chair when we sit. The other thing we need to pay attention to is the height of the chair. Now this chair is quite lifted up, so when I'm sitting down with my foot rested on the floor, you notice that there is a downward slope of my thigh with my knee pointing forward. Now, ideally you need to have the knee at the same level as the hip, so as to make a right angle at the hip, or you should have it slightly above the level of the hip. So this I can do by adjusting the height of this chair. You can just lower it down, and then you can have a very comfortable position where the knee is slightly higher than the hip. The second point, as I mentioned, is the posture. Now normally we have a tendency when we sit in chairs or sofa to slouch, and by slouch I mean doing this, leaning, going forward a bit and then doing that. And by doing that you notice instantly that there is no support to the lower back, and that puts a lot of strain on the spine. The second thing that we tend to do is if you're sitting at the desk, for example, using computers or reading something, is to lean forward and slouch slightly. And when you slouch, again, it puts a lot of strain on the lower back. So what you need to do essentially is to move further back in the chair. So you shift your bum backwards and then lean against that backrest so that you get a good supported lower lumbar spine. And these are the things that you can do ergonomically to try and improve the symptoms of your back pain. So in this exercise, we have to shuffle forward in the chair and then try and bend at the hip and cross your hands underneath your thighs and hold that position, feeling the stretch at the back of your spine for a few seconds, and then come back to neutral. So make sure that you don't arch your back upwards. It's a matter of just flexing at the hip level so as to stretch your lower back. Hold the position for a few seconds as you feel comfortable and come back up again. The idea of this exercise is to stretch the lower paraspinal muscles of your back and the abdominals. So for this you need to lean forward and arch your back and then push back into your tummy so as to stretch and contract the posterior paraspinal muscles of the lower back. You can do this as many times as you feel comfortable, and then relax. This is a simple exercise which we have done before for the knee as well. All you need to do is just shuffle forward in the chair, extend your leg and try and slide down your hand along your shin as much as you comfortably can, keeping the knee straight as possible. The idea is to stretch the hamstrings, which are the muscles at the back of your thigh. Stretch and hold the position for a few seconds by bending at the hip. You can alternate the sides, holding for a few seconds and then relax back into your seated position. So seated piriformis stretch. Piriformis is a muscle which is at the posterior aspect of your hip. You just need to cross your leg. Try and put your knee down so that your shin is sort of parallel to the floor. Then you have to lean forward at the hip. When you feel the stretch at your buttock area, hold that stretch for a few seconds and then relax back again. So cross your leg with your ankle over your knee. Try and push down onto your lifted up knee so that it's parallel to the floor, and then lean forward, hold the stretch for a few seconds and then relax. So this exercise stretches both your abdominals and your paraspinal muscles at the back. You just need to sit and twist your torso by stretching up as straight as possible and twisting at the same time. You can hold on to the armrest just to give a bit of support. Hold the position for as long as you can and then come back to neutral, and then just repeat the same movement on the opposite side. The idea is that you should feel the stretch at the back and the abdomen, and don't force this movement. You just need to do as much as you feel comfortable with. This exercise is similar to the previous one. The only difference is that in this one you cross your leg comfortably and then do the same twist. Twist your torso, feeling the stretch, hold on to the armrest as required, and you can hold the stretch for a few seconds and then come back to neutral. Repeat the same on the other side, and you can repeat the same couple of movements a few times in order to feel maximum stretch in your lower back. Now you may be asking the question or wonder, how do these exercises help? Now if you understand the principle behind why we do these exercises, then you'll probably be more inspired and motivated to do the exercises to treat your back pain. When we sit, most of the time we tend to sit in a chair like this. So what happens is, over time the lower back muscles take a lot of strain because your body weight sort of goes through that. The gluteal muscles, which you don't use at all when you're sitting, they become weak over time, and then you have muscles in the front of the hip. So this become quite contracted, and this remain in a contracted position and also become weak as a result of that. Then you have the hamstring muscles, which are at the back of your thigh. They also remain in a slightly contracted position because these muscles run from your seat bone all the way across your knee into your leg. So when you're sitting in this position, the seated position, you tend to have a contracted hamstring, contracted front of hip muscles, the psoas muscles, and then you have weak back muscles and gluteal muscles. So all this together tends to contribute towards putting more strain on your back and hence low back pain. This exercise is called the lateral wall slide. It is an exercise done to strengthen the gluteal muscles, especially the gluteus medius, which is the muscle over here. So this is quite simple to do. What you need to do is to stand with your side against the wall. You can stabilize yourself by holding on to the wall like that, or placing your hand against the wall. The idea is that you put your pelvis against the wall, and then you bend your knee and lift your pelvis sliding against the wall. So when you do this, you're primarily using the gluteus medius muscles on the other side to stabilize your pelvis, and you need to hold this for about 5 seconds. So you count 5, 5, 4, 3, 2, 1, and then come down. Easy to repeat. You can put your pelvis against the wall, bend your knee, let your hip slide up against the wall, and then you feel the contraction on the opposite side. Hold that for a count of 5, 5, 4, 3, 2, 1, and down. This next exercise is the hip abduction and extension kick. So for this, you need to face the wall, The idea of doing this is to work out the gluteal muscles. So you need to face the wall. You can stabilize yourself against the wall, whichever way you want to do, either putting your fist against the wall or your hand against the wall. Make sure that you're well stabilized. And then you need to lift your leg up backwards and to the side. So the idea is that you need to feel the contraction in the gluteal muscles. You need to hold this position for about 5 seconds and then come back down again. What you got to watch out for is that you should not be arching your back too much. So you should not be doing something like that. You don't have to do that. What you need to do is just to lift the hip backwards, straight back, and then to the side. Feel the contraction in your muscle. Hold that for 5 seconds and come back down. This next one is to stretch the psoas muscles, which run from the front of your spine and the abdomen all the way across your hip and is inserted into the top end of your thigh bone. So you need to stretch this muscle. So what you need to do is to stand up and get into sort of a lunge position, and you can then bend your knee and let your hip drop down. And when you do this, you'll notice that the muscle which is supposed to be in this area will stretch. That's the psoas muscle which is stretching, and you hold that position for a few seconds and then come back up. Repeat the same. Move your knee forward almost to a lunge position. Keep your trailing leg bent backwards like this, so as to stretch the front of the hip. Feel the stretch, hold it for about 5 seconds and then come back up. Now there is an often neglected muscle called the piriformis, which is an external rotator of your hip. This muscle basically helps to twist your thigh bone outwards, and this muscle is often very weak, tight and contracted and neglected in most of your exercises. So this is a very simple way to stretch this muscle, which is crucial if you want to avoid low back pain. So this exercise, you just need to lie on the floor, bend your knee like that, and then you need to just almost cross your leg, put your ankle over the lower part of your thigh of the other leg, and then you need to put your hand between this, hold that, and then pull backwards. When you pull backward, you tend to stretch the piriformis, which is the muscle over here, and then pull it back as much as you can, hold it for a few seconds, and then relax. So same again, you cross your leg, put one hand between your legs, the other hand on the other side of the thigh, hold on to the thigh and pull backwards. When you pull backwards, you stretch the piriformis muscle, hold that position for a few seconds and relax. This next exercise is called the bird dog exercise. This improves the core stability and strength of your paraspinal muscles and also your abdominal muscles, and to some extent your gluteal muscles as well. So it's very easy to do. What you need to do is to just sit on the floor like this, go down on all your fours, make sure that you're well stabilized. You can place your arms at about shoulder width apart, and then what you need to do is to lift your left arm and right leg at the same time and hold that position for as long as you can. In the beginning you might just be able to hold it for about 3 to 5 seconds, but do that, hold that position and then bring down. And you can repeat the same thing on the same side. Lift up, keep it as straight as possible, steady your core, hold that position for a few seconds and bring straight down. What you need to make sure is that your abdomen and your midriff does not sag. So you should not be going down into that position when you do this exercise. Try to make it as steady and straight as possible when you do this exercise. So those were the simple exercises that you can do on your own at the home or the office. Now these are exercises which are very basic and just to get you started. Remember that every change begins with a small step, and persistence and consistency counts. The beneficial effects of these exercises might not be apparent initially, but as you keep persisting with the exercises over time, the cumulative effect builds up, and then you will start noticing results and you'll start getting a handle over your low back pain. If you are comfortable with doing these exercises, then you can always advance to more stronger and more heavier exercises. And you can add some resistance by using exercise bands, for example, or some free weights to do the exercises. So do look after your back and it will serve you well. That brings us to the end of this video. I hope it has been of use to you. If you have liked this video, then do give us a thumbs up by clicking the like button, and also press the subscribe so as to be notified of further videos coming up on various orthopedic conditions. Your comments are always most welcome. So as always, keep moving, keep fit and stay healthy. This is Dr. Vinod signing off. Namaste. If you like this video or found it useful, don't forget to like, share and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.